My name is Rondi. I am a second year med student in Southwestern University, and I'm here to examine the respiratory system. What is your name again?
My name is Jenny, 28
Years old. When were you born?
June 5, 1993.
All right, Jenny. Can I have you your feet here, laying down, and go ahead and lay down. There you go. I'm going to be inspecting you just for a bit. Just go ahead and be normal for me. I'm also going to be checking to see if there's any abnormalities in your chest, scarring, or any of that sort of thing. Okay, so I'd like you to put your hands out for a bit. There you go. I'm going to check and see if there's any cyanosis in your fingers here. Put them down. I'm going to check your temperature. Check the temperature of your arms. Alright, I'd like you to go ahead and raise your arms. There you go. Alright, I'd like to see if there's any tremors, anything of that nature. Okay. I'd like you to raise your fingers up like this. Check and see if you have CO2 retention. Alright, go ahead and rest your arms. Go ahead and put your ring fingers like this. There you go. I'm going to check and see if there's any kind of clubbing. Relax. Very good. Okay, now that you're here, I'm going to check your pulse. Go ahead and start now. I'm going to wait for 30 seconds and just multiply it. It looks like your pulse rate is 90 beats per minute, so that's pretty normal. Check your breathing rate. Could you breathe for me normally for about 30 seconds, and then we'll just check. You can go and start now. Right. Well, it looks like to me like you have 18 breaths in 1 minute. 12 to 20 is the range for normal. All right, I'd like you to turn your head this way for me. I want to check and see your jugular vein. It's normal. Everything's good. All right, go ahead and look at me to check and see for central cyanosis. Thank you. I'm going to put my hands on your eyes here, just below. I'm going to push this down a little bit. Just relax and look up for me, please. I need to see your conjunctival pallor. It looks like everything is normal. Thank you very much. And now, could you take off your mask for me? Thank you. Can you open your mouth? Point your tongue upwards to the roof of the mouth. There we go. Looks like everything seems normal here. Go ahead and relax your mouth. You can put your mask back on. Alright, so now I'm going to check your lymph nodes all along your neck area to see if there's anything unusual. So just bear with me a little bit here. So I'm going to check the back here. Also, your occipital. If there's anything unusual. Looks like everything's normal. Thank you. Have you look up just a bit here. I'm going to go to your the sternum and check and see the distance here. Looks like it's normal. I will also be checking your chest expansion later, towards the back, if that's okay with you. It seems like it's going to be a little bit more difficult to do it at the front. Alright, Jennifer, I'm going to percuss your chest. Give me a moment right here. I'm going to put my hands here, if that's okay. Axilla area. Now, I'm also going to auscultate, check and see if there's any unusual breathing. So every time I place a stethoscope on you, I'd like you to breathe in normally for me. Take a deep breath in and out. And then after that, I'll move on to the next part. Alright? Here we go. Go ahead and breathe much. Now, I'm going to have you say 1, 2 for me. I'm just going to check and see if there's any awkward resonance. All right. Okay, let's say 1, 2.
1, 2.
Every time I put my stethoscope, just to say
1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2.
All right. Thank you very much, Jennifer. I'd like you to go ahead and sit here. Go ahead and sit here. Go ahead and turn. There you go. I'm going to now examine, excuse me, I'm going to examine your posterior. I'm going to be doing the exact same thing I did in the anterior, except it'll be a little bit more thorough because I have further access here. Can you put your arms crossed and have your, yeah, there you go. That's right. This will give me more access. What I'm going to do is I'm just going to check here. I'm also going to check your breathing. Go ahead and breathe for me. Just regular breathing. See anything unusual? Alright, so I'm also going to put my hands here. I'm going to check the distance that my fingers move as you breathe. And that normal distance is about 2 to 3 centimeters. So go ahead and breathe deep for me. Deeper. There you go. Again. Try again. Yeah, go ahead. Thank you. Okay, now I'm just going to follow the same pattern as I did before. Just go ahead and... normal. I'm going to put my stethoscope on right now. I'm going to oscillate once again. Just breathe normally every time I place stethoscope. Go ahead and breathe in. Like there's no crackling, no rails or anything of that nature. All right, I'm going to have you say 1, 2 once again, and then I'm going to check the resonance.
1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. And that concludes the examination for respiratory. Thank you very much. Okay, today I performed a respiratory exam on Jennifer. She's a 28-year-old. She didn't show any signs of respiratory disease. Her breathing was normal. When I percussed the front and the back of the chest, everything seemed normal. In auscultation as well, this is a normal respiratory exam. To complete this exam, I would have her be sent to the lab for a sputum sample and also to measure O2.